right, Alden, the recording has started. The conference is yours.
All right, thanks, Budham. Good afternoon, everyone. This is a applicant briefing for public assistance for DR 4530 COVID-19 declaration. My name is Alden Graybill. I serve as the Recovery Programs Director here at OEM. And within the division, we have the Public Assistance Program, the Hazard Mitigation Program, and the Individual Assistance Program. To start things off, we have a message from Director Gower. He asked me to please express my wishes for everyone. We are happy to engage with them on this process. Understanding the nation is in uncharted waters. OEM and other staff are committed to customer service and support to assist all the applicants through this process. This process can look challenging to understand, but I want you to know OEM is here to assist you into the reimbursement process for eligible expenses. For the agenda today, we'll provide an overview of the delivery of Public Assistance Grant Program for DR 4530. We'll talk about the PA process, then general PA eligibility, any additional considerations, some long-term grants management, and then the next steps. If you have questions along the way, please type them into the comments section of the WebEx. We'll pause every few slides so that Putnam can read the most recent questions. If some of the questions are very specific to your jurisdiction, we may hold those and then get with you one-on-one. So the public assistance process for COVID-19. The program provides funding for emergency management assistance to save lives and protect and assist with funding for permanently restoring community infrastructure affected by a federally declared incident. FEMA is continuously adding more information on their page, which can be found by going to fema.gov/coronavirus. We'll be sending this PowerPoint out later this afternoon. Many of these links in this PowerPoint, you can just click on them and they'll take you directly to the page. The declaration summary for this disaster, the number is DR 4530. The declaration date was April 5th. However, the incident period started January 20th and is still continuing. The type of the declaration was for a pandemic, or coronavirus disease 2019, also known as COVID-19. The designated areas are all 77 counties in the state of Oklahoma. Currently, the only category of work that is approved under public assistance is Category B. The cost share approved currently is 75% federal, 25% non-federal. The leadership for this disaster, Mark Gower is appointed as the governor's authorized representative. Mr. Tony Robinson, who's also the regional administrator, Region 6 for FEMA, is appointed the federal coordinating officer. The state coordinating officer is myself. Deputy state coordinating officer is Mike Teague, and our federal infrastructure branch director is Don Simcoe. Terminology. When an entity applies for PA funding, it is the applicant. Once the applicant receives funding, it is either the recipient, pass-through entity, or a subrecipient. For simplicity, the term applicant is used throughout this PowerPoint when referring to the responsible entity for a project, rather than making distinctions between an entity as the applicant, recipient, or pass-through entity. Typically, the state of Oklahoma is the recipient, and municipalities, counties, and eligible private nonprofits and tribal nations can serve as subrecipients. FEMA's quick guide tools and others will be available in a toolkit that we'll provide after this presentation. This slide describes the pre-obligation process. This is the virtual applicant briefing. If you already have a FEMA portal account, there is no need to create a new one. RPAs must be submitted through ok.emgrants.com. Once your RPA is approved by FEMA, you may begin submitting COVID-19 simplified project worksheets directly to FEMA through the FEMA grants portal. And this slide describes the process for that. So again, to today is the virtual applicant briefing. You'll either use your existing logon or you'll create one for FEMA Grants Portal and OKEM Grants. You'll submit the request for public assistance through the state of Oklahoma's EM grant system. And then once you've filled out the form, which we'll discuss in detail in a few minutes, you can load that directly into the FEMA Grants Portal. Once you've submitted that documentation, FEMA and the state will review the documentation, and then the project will be formulated and sent back to you as the subrecipient for a final signature. Once the project is obligated, the funds will be placed within the state's SmartLink account, and then we can work with you on a one-on-one basis to get you the funding. Post-obligation processing. Once a project has been obligated by FEMA, it will be administered using okemgrants.com for the duration of the grant lifecycle. So what you can think of is the project formulation happens in the FEMA Grants Portal, and the obligation or the financial management side of it, the grants lifecycle happens in OKEM Grants. The steps in OKEM Grants are obligation, quarterly reporting, advance and reimbursement requests, and closeout and validation requests. And then, of course, all of this is retained for auditing purposes. Requests for public assistance forms must be submitted through the state's grants management system. Again, that's ok.emgrants.com. New users will need to register for access. Returning users will log in with their existing credentials. A how-to training video is available under the resources section of ok.emgrants. Emergency managers are encouraged to reach out to their regional coordinators for help gaining access to the system. Before an RPA can be processed, the requesting entity must have a valid DUNS number that is active on SAMS.gov. OEM will validate the DUNS number before the RPA is submitted to FEMA and before any payments are processed. The COVID-19 direct application form. FEMA or the recipient may provide limited remote technical assistance to certain applicants. As Director Gower mentioned in his welcoming remarks, we're here to help. We will do what we can to help you. However, the onus is going to be on you as the recipient to manage your documentation and to load it into the system. For COVID-19 declarations, once registered, applicants will have the ability to submit reimbursement requests for assistance directly through the FEMA Grants Portal without requiring traditional exploratory calls or a recovery scoping meeting. These steps have been eliminated for this disaster declaration. FEMA has quick guides and how-to videos that provide step-by-step instructions and can be found in the Grants Portal, and that's the link for it, grantee.fema.gov. Again, you have to have credentials to access that. For technical assistance with FEMA Grants Portal, applicants can call the Grants Portal hotline. This is a FEMA managed and staffed hotline. It's 1-866-337-8448. Applicants will need the following information about their activities and costs to complete the fillable direct application form. You'll need a description of activities, including when, where, and by whom the activities were completed or will be completed. A summary of how much the activities cost, including costs associated with contracting, labor, equipment, supply, material, and other costs. Documentation supporting the activities completed and costs claimed, and certification of compliance with federal, state, tribal, territorial, local laws and regulations. This form is approximately 33 pages in length. However, the majority of subrecipients will only need to utilize about 7 pages of the form. How to complete the project application? FEMA will process each project application submitted as a separate funding request. To reduce funding delays and maximize applicants' administration flexibilities to track costs, applicants should generally report all activities on one project application. However, submitting a separate project application for distinct activities or time periods is advisable in certain scenarios. When an applicant needs to be reimbursed immediately and cannot wait to gather all information to submit a full claim for all of their activities and costs, the applicant may request expedited funding to receive an award of 50% of the total cost behind the limited documentation. The state advises that subrecipients understand that requesting expedited funding means that you have to have validated all of your information for that expedited project before any further project worksheet can be obligated and paid to you. Certain activities may require FEMA to complete a more in-depth environmental or historical preservation review. For example, ground disturbance, hazardous materials, modifications to buildings, or new construction. For these activities, the applicant should submit one of the project applications for activities with environmental or historical preservation considerations and another project application with the remaining activities. The next slide, I'll explain a little bit more about how that works. But in general, the work has to be the responsibility of the applicant. FEMA will not accept paper submissions. You must use the FEMA grants portal to submit your documentation. And again, they'll be processed as separate funding requests. So with the project application sections, what I was describing a moment ago with EHP, this breaks out how the project worksheet direct application form can be utilized. So again, for most projects that are considered small projects, that's less than $131,100 in project costs, are considered small. Those applicants will need to fill out the first 4 sections of the form, in addition to the Schedule EZ and possibly the Schedule F. The project application has, again, 4 sections and 6 supplemental schedules. All applicants must complete 1, 2, 3, and 4 and one of the following schedules. Schedule F is when claiming costs for activities that may have environmental and historical preservation concerns. This will be a great reference document for you. It's in the direct application form. It's a cover sheet for your reference in addition to this PowerPoint, but it will guide you which schedules you will need to complete in addition to what sections of the direct application form will be required. I think it's important to note for everyone at this point, the minimum project worksheet amount is $3,300. So before your jurisdiction can make a claim for eligible costs, you must have expended more than $3,300. Otherwise, the project would not be fundable under FEMA's guidance. The sections are Section 1, Project Application Information. It's very short. It collects information such as the declaration number, the applicant's name, etc. Section 2 describes the scope of work, where you'll describe the activities you have conducted or will conduct in response to COVID-19. Section 3 will be where you supply the costs of the activities reported in Section 2, and you must also complete the appropriate schedule. And Section 4 is where you will certify that the activities and costs reported to the project are applicable and comply with applicable laws and regulations. So for example, sections 1 through 4 are 5 pages, and the EZ schedule is 2 pages. So again, for jurisdictions that have a small project and will not have any environmental or historical concerns, the application will only need to complete 7 pages of the application and upload the supporting documentation to have their project worksheet formulated. At this point, I'll take a brief pause to see if there are any questions that are outstanding.
Yes, sir. This is the operator. We have some questions and a few notes real fast. I know it's been stated that the slides will be sent out, and just a reminder for all people that the slides will be sent out later and posted so that they have them. Also, there was a correction. The government site for people to SAM is sam.gov. Once again, sam.gov. And a few questions here. How long does it take to get approval? A applicant was or application was submitted a couple of weeks ago. That's question number one I have.
Okay, the application, it kind of depends on the status of the SAMS.gov DUNS number activity, in addition to the completion of the RPA form. I'd suggest reaching out one-on-one and we'll look into your specific situation.
Okay. Next question. If everything is to be on one project worksheet, do they wait until the end of the event to submit? And what about reoccurring costs?
So that's a great question. So you can do it, you can submit your costs multiple ways. Again, FEMA's looking at it by category, which is only category B, and you can wait until all of those costs have been submitted, tracked, and then you're ready to be reimbursed. Or you can break them out by a time period, or if you have a large amount of costs that you need to submit for reimbursement, we can work with you to do that as well. So really, it's very flexible in how it's being delivered. It's driven by you and when you submit your costs. If you say submit your timesheets on a monthly basis, that's fine. FEMA will fund those projects, but they may fund them as singular project worksheets, or they may combine them into one and just keep versioning the same project worksheet. It'll really kind of depend on a one-on-one basis.
And looking for clarification on the website portals that you were just talking about in this prior section, EM grants, sam.gov, what do people expect to do what in each portal?
Okay, so again, FEMA grants portal, these links will be sent out, but it's grantees.fema.gov. That's the FEMA grants portal, and that's what you'll use to submit your documentation to have the project formulated. OK, period, EM grants, period, com is the EM grant system that Oklahoma utilizes, and that's the system we will use to manage the grant life cycle, in addition to collecting your requests for public assistance.
Next question. Where is the 25% coming from? They've asked their county health department and they know nothing about it.
So FEMA grants are set up on a 75% federal share, 25% non-federal share cost match. What that means is that there is a local match of 25%. Historically, Oklahoma has been able to pay, in some cases, half of the non-federal share, which is 12.5%. I'm not quite sure the question on the health department, so I'm going to encourage you to reach out again one-on-one and we'll address your question.
Who is the contact to check with on certain eligible costs?
So that's a great question, and that's actually something we're going to cover here in just a little bit, but we are recording this briefing and we're going to give it out in multiple different ways. One, we're going to load it onto our YouTube channel, and then we may also drop it where we're putting our local EM calls. But with that, we're encouraging anyone that watches this briefing later on to submit their questions for eligibility to public.assistance@oem.ok.gov. Again, it's public.assistance@oem.ok.gov. We'll try and that'll reach multiple PA staff here at the state, so hopefully that'll get you the quickest answer. You're also welcome to reach out directly to any of your area coordinators, your regional coordinators. They'll be able to either answer your question or get you to the right person. And then, of course, you're also welcome to reach out directly to Mike Teague, our public assistance officer, as well as myself.
Do they need to submit to EM grants and the FEMA portal or just work through EM grants?
So they'll need to submit their request for public assistance and OK EM grants. Once they work on the simplified direct application form provided by FEMA, they'll need to upload that into the FEMA grants portal.
And that's the same thing as the project SLA?
The project SLA will be downloaded out of the EM grant system, signed, notarized, and then submitted back to public.assistance@oem.ok.gov. We'll have Director Gower sign it, and then once it's executed, we'll load it back into OK EM Grants.
This operator, that's the last of the questions for right now.
Okay, great. We'll keep moving. So a process overview. What we've discussed, we're having the virtual applicant briefing right now. You will either register in OK EM Grants and submit your request for public assistance, or you'll simply log in using your existing credentials to submit your RPA. Once that's done, you'll register in the FEMA Grants portal if you haven't done so already. That's where you'll upload your documentation, the simplified direct application form and the supporting documentation. That information will be reviewed by the CRC. That's a FEMA Central Resource Center. That's where they actually formulate those projects. Once it's formulated, the state and FEMA region will review the project. It'll be sent to the applicant for signature. And then after that, funds will be obligated to the state. And if your state and local agreement has been executed, then we'll work with you on the reimbursement process. For small projects, we typically pay the full federal share once they are obligated. For large projects, that's anything, again, over $131,100. We'll work with you on a case-by-case basis, but typically that's reimbursable at the end of the project. Again, and that's where project closeout comes into play. So what happens after submission? FEMA and the state review the project application and validate the information and documentation provided to ensure compliance with all laws and regulations. If there are additional questions to evaluate the eligibility of the project application, FEMA and the recipient will contact the applicant to discuss. This may include contacting the applicant by phone or through public assistance through the FEMA Public Assistance Grants portal. Upon completion of these reviews, the applicant will be notified that the funding for their project application is ready to be awarded. The applicant will be required to review, agree to the terms and conditions, and sign and accept the subaward in the Public Assistance Grants portal. Once the applicant signs the subaward, FEMA makes funding available to the recipient for disbursement to the applicant. Once FEMA obligates and transfers the funding for the subaward, the applicant will become the subrecipient in the public assistance program. That's the transition between the FEMA Grants portal and OK EM Grants. The state, the recipient, will work directly with the subrecipients to monitor and report on the status of activities, comply with federal and recipient grant requirements, and to close the subaward in compliance with 44 CFR and the corresponding federal laws and regulations. Completing it and submitting the COVID-19 streamlined project application. This is a screenshot of the applicant quick guide that will be provided in the toolkit. It'll help you walk through the process of submitting the direct application form in the FEMA Grants portal. It has screenshots as well as directions on how to go about doing that. And again, it'll be in the toolkit that we'll provide with the actual form. Now we're going to transition to some generic PA eligibility. We're going to first discuss the building blocks of public assistance. But before we do so, we're going to take a pause again real quick to answer any final questions we may have had in that first section. Putnam?
This is the operator. I have one question so far. Who approves the FEMA portal access?
So the subrecipient will make the request in FEMA Grants portal, and it should come to the state of Oklahoma for approval. If not, it'll be approved by FEMA directly.
And I have one additional follow-up. They have a temporary person that I think needs their own login. Who do they contact?
So once the applicant has been given access to FEMA Grants portal, typically the emergency manager or the primary point of contact on the RPA will be granted administrative rights for their jurisdiction. and they'll be able to add their own staff and manage their own staff within FEMA grants portal. So short answer is they will be able to do so, but if they have any questions, obviously they can reach out to any of us at the state or at FEMA.
Very good. Just a note for those that are connected via computer, if you cannot see the slides, you need to check your settings. We are validating that the slides are going out as expected over the conference call. So at this point, there's not much we can do other than send them out later if you're not able to view them. Next question, can we get the original signed by Mr. Gower returned to the city? City clerk wants the original he has signed. That would be the original documentation.
We can work with you on a one-on-one basis to get you an original copy. Just reach out to us and we'll arrange that.
Let's see, account has expired on the portal. Who resets the account?
You can reach out to Mike Teague at the state public assistance officer. His email address is Michael.Teague, T-E-A-G-U-E at oem.ok.gov. Just send him an email or send it directly to public.assistance@oem.ok.gov, or send it to both, and we'll work with you to get it reset.
Okay, this is the operator. That's all the questions I have for now.
Okay, great. Next, we're going to discuss work eligibility for DR 4530. Again, has only been approved for Category B at this time. That's emergency protective measures. Eligible work includes management, control, and reduction of immediate threats to public health and safety, emergency medical care activities, in this instance, medical sheltering, security and law enforcement, communications of general health and safety information to the public, and reimbursement for state, tribal, territorial, or local government force account overtime costs. So I will pause here for just a moment, and I will point out that for Category B, typically straight time is not eligible under Category B. Only overtime is. And it's going to depend on how your jurisdiction's pay policy is written before the disaster was declared. So for example, if your pay policy says that you are not allowed to accrue comp time or you are not paid for overtime, then FEMA will not reimburse you for those costs. Work eligibility, key points. It has to be due to an immediate threat resulting from the declared incident. And again, you have to have legal responsibility for those costs. You are allowed to enter into mutual aid agreements. There is a statewide intra-state mutual aid agreement in place. Many times that will suffice for what you're wanting to do. However, we encourage you to reach out directly to us if you are going to enter into a specific mutual aid agreement so that we can help you address any eligibility issues that you might have. Cost eligibility, key points. Again, it has to be directly tied to the event. That is the efforts. It has to be in line with local policies, state policies, federal policies, and procedures. And FEMA is very specific on costs being reasonable. And the way it's written, the program is written in the gray area is to allow for you to have flexibility with what costs you're faced with. So if you're going to enter into any kind of contracting, we encourage you to reach out to us here at the state so that we can help you with the contracting, any eligibility issues that you may have, as well as we can have the reasonability conversation. The quality of your documentation will determine the speed you will receive reimbursement. Providing all the documentation to FEMA and the state in an organized fashion will result in a reimbursement process that may take months. Providing piecemeal and inadequate documentation will result in reimbursement process that could take longer than needed. So we highly encourage you to be organized, to document what you do in a way that you can tie it to COVID-19. And then whenever you upload it into the system, be as organized as possible. So upload the completed simplified application form and then be very specific with the documentation that you upload and communicate how it applies to the application that you've uploaded. Labor cost documentation, so to give you some examples, signed timesheets, activity logs that provide details that describe specific tasks and accomplishments, payroll information, payroll records, check records, payroll policies, overtime policies, and fringe benefit rates and policies. Equipment documentation, equipment logs, which show the number of hours the equipment is used, mileage logs if the vehicle is being used for transportation. Additionally, all equipment must be tied to an operator, and the following information is needed for the operator: signed timesheets, payroll information, payroll records, and check records. One of the things that we see often when working with applicants to submit their documentation is they'll submit records for their personnel and records for their equipment, and many times they do not match. For example, sometimes the equipment is logged more hours than the person put on their timesheet. We understand that there are cases where an operator may use multiple pieces of equipment, so we ask that you be mindful of that and that you explain it well whenever you submit your documentation. Contract expenses, we look for invoices, contracts, amendments, change orders, task orders, always proof of payment, and procurement documentation. For this disaster emergency procurement, a memo was issued by FEMA. The links are provided in the slide here, and we'll also provide this again after the presentation is concluded. However, again, FEMA's looking for cost reasonability, that the costs are necessary, and that local policies were followed or waived if the documentation is still needed to show the waiver and how the waiver complies with the policy. FEMA looks for the most restrictive policy. So if the federal policy has been waived, the state policy has been waived, but your local policy has not, then you have to follow your local policy. Contracting. Time and material contracts are discouraged and will be ineligible unless the following is true. No other contract was suitable. The contract has a ceiling price that the contractor exceeds at his own risk, and the non-state entity can demonstrate it provided a high degree of oversight to obtain reasonable assurance that the contract used efficient methods and effective cost controls. Again, that's time and material contracts. Cost plus percentage of costs contracts are ineligible. Piggyback contracting is generally ineligible. Contracts over $10,000 must include clauses for termination for cause and convenience. Contracts over $250,000 must include all federal provisions listed in 2 CFR Part 200, Appendix 2. Donated resources, labor, equipment, and materials can be used to offset the non-federal share of your award. Again, it is a 75%, 25% cost share, 25% being on the applicant. This is an area where you can utilize to offset that local federal or that local share. The following applies. Donated resources is from a third party. A third party includes private entities or individuals, including individuals that are normally paid employees of the applicant or federal, state, and tribal government, but are volunteering as unpaid individuals and not on behalf of the employer. The donated resource is necessary and reasonable. The applicant uses the resource in the performance of eligible work and within the respective project's period of performance, and the applicant or volunteer organization tracks the resources and work performed, including description, specific locations, and hours. In the toolkit that we'll be providing, we have included some Excel sheets that the applicant can use to track these donated resources. They're also available on our website at ok.gov/OEM. Applicant eligibility. Applicants or subrecipients can be state agencies, tribal governments or organizations, counties, municipalities, cities and towns, local public authorities, school districts, agencies of local governments, special districts established under state law, and certain private nonprofit organizations. Ineligible applicants, businesses, private nonprofits that do not provide medical, educational, emergency, or utilities, and individuals. Other federal funds that are currently available, Congress has appropriated for this incident. The most notable includes funding from the Health and Human Services, the Centers for Disease Control, and the CARES Act. These funds can be used for similar costs and have differing cost shares. Before we move on to work eligibility, I'm going to pause and answer any questions that may have come up.
Very good. This is the operator. I do have some questions. Is temporary contract labor specifically hired to assist with this incident covered with regular time cost reimbursement instead of overtime only?
The answer would be both.
Okay. So is the purchase of PPE and related supplies eligible?
Yes. Under Category B, emergency protective measures, those items are eligible. However, it's important to remember FEMA is only going to reimburse what is used. So it's important that if you buy, say, a pallet of water, that you distribute the entire pallet of water. Otherwise, when FEMA comes to reimburse you, they're only going to reimburse you for that specific amount of water that was used off that pallet.
And what about accommodations to allow, let's say, courthouse staff to work from home?
I'd need more detail on that question. Again, their straight time would not be eligible. Their overtime could be. Any of the measures that they've taken in order to implement telework probably are not going to be eligible. But again, it's worth having the conversation. So please go ahead and reach out or submit your question to public.assistance@oem.ok.gov.
Two examples for, since we have people on the call, laptop purchases or paying for Zoom.
Typically, those costs would not be eligible.
Okay. What is a reasonable cost for PPE? Every time they talk to someone, the cost goes up.
Again, we would have to have that conversation on a one-on-one basis. There's no generalized amount that I can provide.
Donated resources, how do we assign a value to donated cloth masks?
We'd encourage you to document each call that you make and each proposal that you receive. And then when it's time for you to submit your documentation, you can reach out to us and we'll help you answer those questions.
That is all the questions.
Okay, great. We'll keep moving. So work activity eligibility. This is the next step in the building blocks of public assistance. At a minimum, claimed emergency protective measures, also called activities, must meet each of the following criteria to be eligible. They must be required as a result of the declared incident, located within the designated area, and again, the legal responsibility of the eligible applicant. There's a link on the slide that takes you to a fact sheet that has been specifically made by FEMA for the coronavirus COVID-19 pandemic, and it will be able to explain eligible emergency protective measures in more detail. Work activity eligibility, floodplain considerations. To determine legal responsibility for emergency work, FEMA evaluates whether the applicant requesting the assistance either had jurisdiction over the area or legal authority to conduct the work related to the request at the time of the incident. Under COVID-19 emergency declaration or major declarations, FEMA may provide assistance for emergency protective measures, including but not limited to the following: management and control of reduction of immediate threats to public health and safety. Site considerations for facilities that deliver critical services must include an evaluation of flood risk to limit the threats to the delivery of service. All critical actions, such as temporary hospitals, should be located outside a high-risk flood hazard area. Again, FEMA has provided a fact sheet for this topic. It can be referenced by following the link in this PowerPoint, And again, we'll provide it in the toolkit. Work eligibility for our private nonprofit applicants. Some PMPs may be eligible for FEMA assistance under COVID-19 declarations if they are legally responsible for performing emergency protective measures. PMPs that own or operate an eligible facility and perform eligible work, such as providing emergency or medical or custodial care services for which they are not legally responsible in response to COVID-19 incident, may be eligible for reimbursement of costs as a public assistance applicant directly. Certain eligible private nonprofits may also be eligible for reimbursement if there's an MOU in place between a legally responsible applicant, such as the city, and that eligible private nonprofit. PMPs that provide non-critical but essential government services is open and must be open to the general public and has applied and been denied for a small business administration loan for permanent repair work. But in this particular case, most of the private nonprofits will not be conducting any permanent work because, again, permanent work has not been approved for this disaster. PA eligible work for COVID-19 through the PA program. FEMA provides grants fundings typically for debris removal category A and for permanent work category C through G. However, those have not been activated for this disaster at this time. Again, emergency protective measures category B is the only active program during this time frame. Emergency protective measures eliminate or lessen immediate threats to life, public health, or safety. Examples of eligible measures are on the next slide, and for more information, please refer to the fact sheet on this slide. Eligible emergency protective measures for COVID-19. Emergency protective measures may include EOC-related costs, medical care and transport, evacuating and sheltering, supplies and commodities, including medical supplies, PPE, and other equipment, dissemination of information to the public, security, law enforcement, barricades and fencing, and temporary facilities. Cost eligibility. This is the next building block of PA. To be eligible for reimbursement, costs must be incurred for eligible work and adequately documented. Reduced by insurance proceeds, salvage value, or other credits. Authorized and permitted under federal, state, tribal, or local government laws and regulations. Consistent with the applicant's internal policies, regulations, and procedures. And necessary and reasonable to accomplish the work properly and efficiently. Again, FEMA looks for the most restrictive policy. Reasonable costs. The applicant is responsible for providing documentation to demonstrate the claimed costs are reasonable. FEMA determines reasonable costs by evaluating whether the cost is recognized as necessary for the type of work. FEMA has provided a reasonable cost evaluation job aid, which will be included in the toolkit that we'll provide after this applicant briefing and can be accessed by clicking on the link in the copy of the applicant briefing that you'll receive. Duplication of benefits. FEMA is prohibited from duplicating benefits from other sources and will reduce eligible costs accordingly. FEMA will not fund any activities or services covered by another federal agency, such as the Department of Health and Human Services, HHS, and Centers for Disease Control, as primary authority to support states or tribal governments in response to infectious disease incidents. FEMA assistance in response to an infectious disease incident is coordinated with the CDC. The point we're making here is FEMA grants are typically the grant of last resort. If a cost can be eligible under another grant, the state encourages you to look at those grants for two reasons. One, there may be a better cost share for you. There may not be a better cost. There may not be a cost share. And then again, if you can only claim it one time. So if you claim it under FEMA, you cannot claim it on another federal grant or vice versa. Insurance. FEMA requires applicants to pursue claims to recover insurance proceeds. Some insurance policies and may be covered under civil authority actions. Generally, the emergency procurement of supplies nor the establishment of temporary medical facilities is an insured loss. If claiming cleanup or disinfection of an insured location, then the applicant must submit a copy of their commercial property insurance policy. There are no obtain and maintain insurance requirements associated with emergency work. I feel like we've covered quite a bit in these last few slides. Do we have any questions?
Yes, we do. Let's see here. First question is going to be hiring a part-time employee, and this was, I think, around our last break, but is hiring a part-time employee for admin purposes, is that covered?
It can be if that's all that person works on.
Are the costs incurred from the FFCRA eligible for reimbursement?
I'd have to have that acronym defined for me, please.
Okay. And while that's happening, a specific question about EOC operations regarding eligibility.
Typically, those costs are eligible under Category B.
Okay. I have not had FFCRA defined yet, so if you want to go on, we might catch that on the next break.
Okay, we'll keep moving. Non-federal cost share. The assistance FEMA provides through its public assistance program is subject to a cost share. Again, the federal share is not less than 75% of eligible costs. Exception, Category Z, direct and indirect management costs are reimbursed at 100% of the documented costs. Since the DRRA legislation was signed into law, states are eligible for up to 7% for admin costs of what the disaster is obligated for. Subrecipients are eligible up to 5% of what their projects are obligated for. These funds can be used again for direct and indirect management costs. A great example would be that question about hiring a temporary staff person to help you. That can be funded through the Category Z project. More about donated resources. FEMA does not provide FEMA funding for donated resources. However, the applicant may use the value of donated resources to offset the non-federal share of its eligible emergency work projects and the DFA. If asked additional details on examples of donated resources, voluntary labor, based on the same hourly labor rate and fringe benefits as a similarly qualified person in the applicant's organization who performs similar work. Donated equipment is based on equipment rates. FEMA provides an equipment rate sheet. Donated supplies or materials is based on the current commercial rates, and logistical support must be reasonable. Logistical support for volunteers doing eligible work may be either for funding or as a donated resource credit. PA management costs. Again, management costs under Category Z may be claimed for administering and managing PA awards as follows. For subrecipients, again, it's up to 5% of the subrecipient's total award amount based on actual documented costs. Eligible activities may include, but are not limited to, meetings regarding the PA program or PA claim, preparing correspondence, reviewing project worksheets, collecting, copying, filing, or submitting documents to support a claim, and training. FEMA has provided fact sheets and guides. They can be reached by following those links. Again, they are also going to be provided on our website. Administrative relief for applicants for COVID-19 declarations. Putnam, since this is a transition in the PowerPoint, we'll pause again to see if you got the follow-up for that question.
Yes, and We should be able to define an acronym like that, but I'm lucky to have a coworker sit next to me that can define any acronym. And the FFCRA is Families First Coronavirus Response Act. So are the costs incurred from that eligible for reimbursement?
That's a really general question. I'm going to encourage the person that asked it to reach out to us directly so that we can get more detail.
Would the provision of breakfast and lunch to school-age students be an eligible cost?
It could be. However, there are multiple grants being offered, and FEMA is typically the grant of last resort. So I would encourage the person asking that question to reach out to their department ed contact and make sure that another service isn't already being offered.
That is all the questions. Well, I have one more that just came in. Are funds obtained through the CARES Act going to conflict with potential PA reimbursements?
Again, you cannot duplicate funding with federal grants. So the answer is yes, they could. We encourage you to keep track of which grants that you're going to be making claims under so that you do not make a duplicate claim. Because if you are paid out of 2 federal grants, typically the FEMA one will be the grant that we ask for you to repay.
That is all the questions I have right now.
Okay, thanks. So procurement for this disaster, many applicants will need to procure supplies, labor, or equipment through contracts. There are other exceptions to this, but the one most widely used and asked about is E&E. For more information, please see the fact sheet procurement under grants conducted under emergency circumstances. Again, this will be provided in the toolkit. For COVID-19 declarations, OMB has implemented administrative relief for applicants. So what they've done is they've relaxed some of the requirements that we have when we do emergency procurement. Sole source procurement under E&E for an emergency needs to be to alleviate the threat to life, public health, or safety, or improve property. If using sole sourcing due to emergency or exigency, you must justify with documentation, use only during the period of actual emergency circumstances, and transition to a competitive method as soon as possible. The exception is applicable to contracts entered into or used on or after July 27th, 2020. So we had the public health emergency began on January 27th, 2020. On March 13th, the nationwide emergency declaration for COVID-19 was declared. And on March 17th, FEMA issued the E&E memo. For the duration of the current federal public health emergency, the ongoing COVID-19 pandemic qualifies as E&E circumstances. Non-state entities may sole source under the exception. State entities have to follow their own state procurement rules. We will also take a moment to encourage you to look at your local regulations and policies, because again, the most stringent one applies in your situation. If sole sourcing under an E&E exception, non-state entities must use only during the period of the actual public health emergency, document and provide justification for the use of the exception, list of suggested elements for justification provided, conduct a cost or price analysis if applicable, and follow bonding requirements if applicable. We encourage you that as you contract to reach out to us directly at the state, and we'll help you walk that process. If sole sourcing under the E&E exception include required contract clauses, follow the T&M contract requirements if applicable. Do not enter into cost plus percentage of cost contracts. They are prohibited. Award contract to a responsible contractor and follow documentation oversight and conflict of interest requirements. Use of pre-award and pre-existing contracts. If the pre-award or pre-existing contract is not in compliance with the federal procurement requirements, it may still be possible to use the contract for the duration of this emergency. FEMA recommends that non-state entities review the requirements applicable to E&E and take actions to modify pre-award or pre-existing contracts when applicable. Justify the use of sole source contracting when suggested. And again, please reach out to us at the state if you're going to do this so that we can help you make sure that what you are doing will fall within the eligible categories. Considerations for state entities, regardless of E&E, follow state procurement policies and procedures, follow procurement of recovered materials and requirements, include required contract clauses, and while the rules do not prohibit the use of T&M and CPPC contracts, FEMA discourages states from using them due to the likelihood of unreasonable costs. Acceptable contracts, lump sum, work within a prescribed boundaries, clearly defined scope and total price. Unit price, work done on an item-by-item basis with cost determined on a unit basis. Cost plus fixed fee, lump sum or unit price contract with a fixed contractor fee added into the price. And finally, time and materials. Limited to a reasonable time based on circumstances during which a definitive, clear scope of work could not be identified. You must be able to justify it. Methods of procurement. Check for debarred contractors at www.sam.gov and look for excluded parties listed in that system. Document your procurement process, compliant with local, state, and federal requirements. And again, it boils down to whichever is most restrictive. Methods of procurement, time and material, and cost plus. Time and material is only to be used under very specific conditions. It's allowed for cut and toss emergency clearance when no other possible alternative exists, and contingency contracts are not allowed. Cost analysis is required by 2 CFR 200.323 Section A. Putnam will pause for questions.
Okay, we have a few questions here. This is a little earlier with our last break. Some cities have received a payment from HHS under the CARES Act, and some said it was geared towards the city EMS response and some not. Does that preclude reimbursement from the disaster?
The answer is maybe. I would encourage you to reach out directly for guidance on that. Generally, I'll say again that FEMA or federal funding cannot be duplicated. So if your jurisdiction takes the CARES Act money, then they will not be able to apply for reimbursement under FEMA for the same costs.
Who should they reach out to for guidance?
You can send your questions to public.assistance@oem.ok.gov. You can reach out to your regional coordinator, and then you can also reach out directly to myself or to Public Assistance Officer Mike Teague.
Will employees that are sent home with pay for being over 65 or with health issues be eligible for reimbursement?
No, not under FEMA Category B.
That is all the questions for now.
All right. Moving on to environmental and historical preservation. All FEMA projects must comply with applicable federal, state, and local EHP laws. Best practices: avoid placement of critical actions such as a temporary hospital in a high-risk flood zone area. Avoid placement in wetlands, brownfields, and other use restricted sites. Place tents, temporary structures, and other modular units on existing parking lots, other hard surfaces, or improve surfaces that connect to existing utilities. Avoid new ground disturbance when possible. Should ground disturbance reveal archaeological resources, notify FEMA and the State Historical Preservation Officer immediately. Again, FEMA has released a fact sheet for EHP, and it will be included in the toolkit and loaded on our website. Post-award grants management. After a subgrant is awarded, so that means once the project has been obligated and the money has been placed in the state's SmartLink account, after an initial subgrant has been awarded and obligated, FEMA will work with the applicant to ensure federal laws are followed with all documentation and process requirements, and update project information as needed before the grants are closed. That flow chart will walk you through the process from award, the quarterly reports, to any amendments that we may have, and then of course appeals and audits, final inspections, project closeout, and then documentation and project requirement management. Quarterly reports, closeout, appeals, and audits. Quarterly progress reports is a tool for FEMA and the state to track the progress of open large projects on a quarterly basis. These are due 10 days after the end of the quarter. Currently, the state of Oklahoma does not require a quarterly report for small projects, as they are paid at the full federal share rate as soon as they are obligated, and then they are closed until it's time to validate all small projects. Project reconciliation and closeout. The purpose of the closeout is for the applicant to certify that all work has been completed and is due no later than 60 days after the work is completed on the facility. Appeals. Applicants may appeal any FEMA determination related to an application for or the provision of assistance under the PA program within 60 days of notification of the action. Audits. Recipients and subrecipients are subject to federal rules and regulations. Documentation and record keeping. Stafford Act Section 705 imposes a 3-year limit on FEMA's authority to recover payments made to state, tribal, or local government recipients and subrecipients unless there's evidence of fraud. The applicant must maintain all original documentation supporting project costs that are claimed. The recipient and the applicant must keep all financial and programmatic documentation for 7 years, as that is a state requirement. So again, FEMA's requirement's 3 years. However, here in the state of Oklahoma, it is 7 years after the date the recipient's final financial status report is submitted. Records are subject to audit by state auditors, FEMA, the U.S. Department of Homeland Security, Officer of Inspector General, and the U.S. Government Accountability Office. Audit issues. The Single Audit Act requires grant recipients expending $750,000 or more in federal funds in a fiscal year to perform a single audit. This is required by 2 CFR 200-501 A through B. Again, this is for all federal funds that you receive as a jurisdiction, not just federal FEMA funds. This may be provided to OEM by properly uploading to the Federal Audit Clearinghouse or by emailing it to OEM at single.audit@oem.ok.gov. Grant recipients must follow the state requirement for record retention as the most restrictive guidance and maintain financial and programmatic records for, again, at least 7 years from the closure of the grant. Button will pause for questions.
This is the operator. There are no questions at this time.
Next steps. After attending the virtual applicant briefing, please make sure your jurisdiction is registered on sam.gov and has an active registration. Request access from ok.emgrants.com and submit a request for public assistance. Once the RPA is reviewed by the state and FEMA, you will receive an invitation to FEMA Grants Portal access, where you will continue the process. If you already have access to FEMA Grants Portal, you will not receive additional notification. Your next step will be to submit your cost using the simplified application form. Other helpful resources, FEMA PA Grants Portal, Grants Manager YouTube channel has that link. There they have descriptive YouTube videos on how to use the system. And again, they have a technical and training support helpline at 1-866-337-8448. For the state, again, we encourage you to reach out to your regional coordinator, to one of us here in public assistance, or myself directly, or our public assistance officer, Mike Teague. And again, public.assistance@oem.ok.gov is where we are encouraging all applicants that have eligibility questions to send their question to. The DR 4530 Applicant Toolkit. OEM will distribute the DR 4530 Applicant Toolkit with the fillable streamlined project application, applicant quick guide, and then again, some helpful documents for you. This concludes the PowerPoint presentation. We'll open it up for any additional questions.
We do have some questions coming in. The first one is a FEMA portal you referenced the same as EMI?
No, they are different systems. FEMA Grants Portal is a software tool that is new and that it's used to interact directly with the applicant and getting their documentation submitted for project worksheet formulation. EMI is an older system that's utilized by FEMA to manage their grants, manage the grants that they've already obligated. To get access to FEMA Grants Portal, again, you'll follow the grantee link that we listed earlier. If you need EMI access, to get external EMI access, please, again, email your question to public.assistance@oem.ok.gov.
I registered on the OEM website 2 weeks ago and have not received approval by FEMA. Possible to check on this.
Please reach out directly and we'll look into your case on a one-on-one basis.
Employees who are sent home for compromised health issue and personnel over the age of 65, labor will not be eligible for reimbursement. I think that's confirming that.
Correct.
How do we sign up to receive the slideshow and pertinent information?
So we'll be sending it to the distribution list that we have for our local emergency managers and our partners. And we'll also be loading it on our website at ok.gov/OEM. If you would like to receive a direct copy or have direct questions, feel free to email me. My email address is alden.graybill. So it's ALDEN @OEM.ok.gov.
Is there going to be a sort of a sign-in sheet for today's meeting?
Well, Putnam, that's a question for you. I know that WebEx tracks who's logged in. Putnam, can you clarify that one?
WebEx is kind of tricky, but we can work through it. Yes, there are ways to do that. So we can certainly try to accommodate registering people who've signed in. And the last question I have right now is kind of more of a statement. So if people want to take this time, if you have any questions, please enter them into the chat. I've reactivated their account, and the FEMA Grants Portal is redesigned. It's completely different. That was more just an FYI to the team. Do we have stop times for all the teleconferences? Yes, pretty much know when we start and stop them, as well as recording them. With all the questions and answers from today's call also be shared after this call. Yes, I am logging all the information on the chat, and we will have that documented, as well as this call will, the recording will be posted on the EM SharePoint site for people to review. And Alden, that is all I have for now.
Okay, the last thing I'll offer for the good of the group, the request for public assistance deadline is typically 30 days from the date of the declaration. However, this incident has yet to have a deadline set. Currently, the RPA deadline is continuing. So please, if you haven't already submitted your RPA, but you think you may have costs, go ahead and submit one and encourage your partners to do so as well. If you have any questions, again, please email the public.assistance email address or reach out to one of us here at the state and we'll help get you the best question or the best answer to your question we can. But other than that, thank you very much for taking the time out of your day to watch this applicant briefing and to engage with us here at the state. This concludes the PowerPoint presentation.